Greetings. Today I'm going to spend a little bit of time talking about post-traumatic stress disorder and the effects on victims of violent crimes, and also the effects on those that work in the field, either investigating or offering therapeutic services. So first, let me go ahead and mention that post-traumatic stress disorder is actually an anxiety disorder. It's classified as an anxiety disorder in the DSM, the Diagnostic and Statistical Manual of Mental Disorders. And basically, I'm going to go over some of the characteristics or symptoms of post-traumatic stress disorder, but I'm not going to do it in a way that focuses on how to diagnose. That's not the goal of this video at all. That would be left for a licensed mental health professional or physician. But basically, with post-traumatic stress disorder, the person's exposed to a traumatic event, and the person either experiences, witnesses, or is confronted with the event or events that threatens death or serious injury or the integrity of the self or others. And this is right out of the DSM, their definition. And also the person responds with fear or helplessness. And some other additional characteristics or symptoms that may occur would be intrusive recollections of the traumatic situation, or having dreams about the trauma, or feeling as if the trauma is still occurring, and having flashbacks, and having physiological reactions to the traumatic event after it has taken place. Maybe someone sees or hears something that reminds them of the trauma, and their heart starts beating very fast, they start sweating, they start getting very anxious, they may have panic attacks, for example, and the person may try to avoid situations that remind the person of the trauma. You know, for example, someone who is in an automobile accident may not want to get on the highway or get in an automobile, or someone who was attacked in a particular location may not want to visit that particular location, or may develop a fear of a certain type of person, for example. And there may be feelings of detachment from the self and others, and there may be other associated disorders like depression. Substance abuse sometimes may be used to try to treat the symptoms, which often makes things much worse. And there may be physiological problems such as sleeping, or rapid heartbeat, or sweating, or getting startled very, very easily. And the duration that the disorder, or the symptoms I should say, and again there's a classification system, you'd have to look at the actual DSM to get that, whether it's classified as post-traumatic stress disorder or not, but it lasts at at least 1 month, or more. And it also creates significant problems in the person's social life or their work situation, or in other scenarios for them. And post-traumatic stress disorder may occur a month after exposure, or it may occur 6 months, a year, or 20 years after exposure. To kind of summarize the major characteristics of post-traumatic stress disorder is that there's exposure and distress to a traumatic situation, and the person re-experiences the trauma psychologically and physiologically. They may become very numb and try to avoid a variety of situations. They may also become very hyper aroused by situations, startled very easily, and anxious. And of course, with post-traumatic stress disorder, when there's traumatic situations, we want to look at comorbidity, or we want to look at other mental disorders that could occur, other anxiety disorders such as I mentioned, panic attacks, but also we could look at situations such as traumatic grief, or depression, and substance abuse, and other disorders that may be related. We also note that stress can be cumulative, or cumulative trauma can build up and lead to greater distress and higher risk for mental disorders, including post-traumatic stress disorder. And I did want to mention that if the symptoms that are similar to what I described occur much earlier, instead of waiting for that 30-day period to elapse, if it happens within a few days, then those symptoms, then the diagnosis may be acute stress disorder, and then may be changed to post-traumatic stress disorder later on. So the DSM offers a diagnosis of acute stress disorder in that regard. Bremner offers an excellent analysis of post-traumatic stress disorder in the book Does Stress Damage the Brain? And Dr. Bremner points out that there may be a dysfunctional stress response and physiological and psychological changes that can lead to a variety of psychological and physical problems. And in essence, stress can damage the brain, and there are a variety of factors related to what happens. And Bremner points out that around 25 to 50% of the population experience traumatic stress, and about 15% will go on to develop post-traumatic stress disorder, which would leave us at an estimate that the general population rate is around 8%. And Bremner also points out that genetic and environmental factors may play a role in the development of post-traumatic stress disorder, and there are effects of stress on the brain in certain areas such as the hippocampus and others. The good news behind all this is that this damage may be reversible through changing one's environment or psychotherapy, and also the use of specific medications. So it's very possible to reverse the process, I guess we could say. Within a more phenomenological or existential view, post-traumatic stress disorder also may lead someone to search for meaning, and so there might be a focus on spiritual issues for some people, and we'll have to discuss that later in another video. And this wraps up this video.